Once again, we're here in Kingsport at the offices of Performance Medicine. I'm with Dr. Tom Rogers. Dr. Tom, appreciate you having us in as always. And we're talking about weight loss today. And when men or women, for that matter, one of the first things that you like to do when they come in is take some blood. And why do we do that?
Right. Well, you know, of course I do a lot of weight loss. I'm not a weight loss center, though.
Right.
You know, I do not want to be known as a weight loss clinic.
Right.
What I am is an integrated medical doctor who tries to figure out why you may have a weight problem or a hormone problem or whatever.
Right.
I really want to find the root cause of it. So one of the first things I usually do is take a fasting blood sample called the Boston Heart Panel.
Okay.
I've done many thousands of these things, and they really tell me a lot about your metabolic system. Some genetic testing's on there, some vitamin levels. You know, not only does it tell me your cholesterol, but how big the particles are, how inflamed they are, how likely to form plaque they are, how insulin resistant you are, not just a sugar level or a hemoglobin A1C, but you know what your actual insulin level is, how insulin resistant you are, what your adiponectin levels are, which is a gut hormone that's complex. Some of the genetic testing like the MTHFR, it's all on this. It's an unbelievable amount of information that I have about you.
Well, I've decided to be that guinea pig today, and we're going to do a Boston Heart Panel on me. So if Robin wants to come forward, I'll roll up my sleeves and donate to the cause, so to speak.
Okay.
But this is, like you say, when men my age want to come in and they're talking weight loss, this is the initial thing.
This is always where I try to start, and this is a test that's covered by insurance.
Right.
And the thing about it, you have to have some form of insurance, but if your insurance doesn't cover it, they eat it.
Yeah.
So you don't pay for this test.
Right.
And so it would cost you $4,000 if you paid cash for it.
Right.
So anybody that has any kind of insurance, that company, it's not me, that company files it for them. If they don't pay it, they're able to kind of eat it because they get reimbursed by a certain amount, so they just don't want to contract with insurance companies. So it's beautiful for me anyway to get this test. So it's very painless, as you know, just a little blood test,
which
she's already
there
got.
in the arm, and there we go.
Yeah, I mean, Robin's so good with this, it's unbelievable. But it takes about 2 to 3 weeks to get back.
I was going to say, how long is the results?
About 2 to 3 weeks, and when it comes back, we're going to sit down for half hour, 45 minutes, and really kind of, I'll be able to tell you a lot about you that you don't know, even some of your genetic testing. But,
maybe some things I don't want to know, but things I need to know.
It won't be anything you don't want to know, but it'll be things that I need to know to guide you. And say your insulin level is really high. I'll know you're pre-diabetic and that we really need to do every effort we can to cut your carbs down. Sometimes I'll tailor medications like metformin to bring that insulin level down. So a lot of times I'll put you on vitamin D because that level will be low. It affects weight loss. It's a great determinant on whether or not you really need a cholesterol medicine or not. Most people probably don't. And it gives me, in 4 months, we'll recheck it again to see what improvements you've made in this. You know, if you want to talk about weight loss, we can kind of tailor a program for you depending on these results I get.
All right. Dr. Tom Rogers, thank you so much.
Hey, thank you.
Ms. Robin's taking my blood, and no problems there. I tell you what, it's the Boston Heart Panel. It's the first step to weight loss here at Performance Medicine, and you can find out more information at performancemedicine.net.